Hello. Well, it's early in the morning. Like, I hadn't gone to bed yet. I've been playing Sudoku, and I've been answering all your comments. I just love it when you comment. I read them when you comment, but I don't always have a moment to respond, or maybe I don't have the right answer to give you yet. Anyway, so today is day 30 since I had my hip replacement surgery. It's amazing it's gone that quickly. Just amazing. I felt like I had slept for the whole month or something. Yeah, your battery's gonna run low and you're gonna die. Okay, so I thought I would tell you some of the details about my surgery. When I got home from the hospital, you have to have the toilet seat at the right height, but it's at the right height in the end. And that was the hardest thing, was going to the bathroom, because you had to keep your legs straight in front of you. And of course, when you finish, you've got to clean up, and you can't just keep your legs where they are. You got to move around. Well, you couldn't do that because the leg has to stay straight, and if you tip it or twist it or anything, it agony pain that it was going to jump out of joint or something. So that was a really hard time. That lasted for a few days, and then it started to get better, and I learned other tricks. Oh. And I used a grasper. I had a grasper in the bathroom so I could, pick up anything that's down low, so I didn't have to reach over. And I figured out how to put my socks on. I would just lay it on the floor, and then with my good foot, I would hold the opening, hold the bottom of the opening, then I would take my other foot, and I would just slide straight ahead into it. And then I could use the grasper and pull it up after that. And sometimes I could just, if I was standing up, I could rub it, and the carpet would grab the sock and help pull it up my foot. Okay, and so at the beginning, I was on lots and lots of pills, and I slept so much, and I did my exercises, which did not really include a lot of walking. I did a little bit of walking, but I was so concerned about hurting it or anything, I didn't want to do too much, and I was in too much pain to do too much. Well, then, as time went on, I was able to, I started using the 2 canes, and then the therapist said I should use one of those walkers that has wheels on the front and not the back, and that would be better for me. So I started using that. And Willem was getting up in the night to get me pills every 4 hours. It was really good to me. And then as I got better, I was taking less pills. But then after I was off all the medications, I could still be on the Tylenol, but I wasn't supposed to be on Tylenol and ibuprofen because of this what is it called? Blood thinner stuff that I was taking. Anyway, so I don't know why I'm buttoning that. But when that medication wore off, the Tylenol by itself was not getting rid of my back pain. I hadn't had any back pain now for a couple weeks or 3 weeks or something. It was amazing to be on morphine and tramadol, either of them or both or one. So my back pain came back, and that's what has crippled me. I mean, my hips had no cartilage, but I really didn't have a lot of pain with them. My back has been what kept me from doing anything, and made it so I couldn't walk. But now these exercises that I was doing 3 times a day, of spreading my leg out and pulling it up and pressing my knee in and squishing my butt, all those things were making the leg very limber. So I started doing them with the other leg too, because both legs, all the muscles have been frozen. And so then I figured out when I went for a walk before, when my back is bad, I could never go for a walk. But I could if I used ski poles or walking sticks. If I used them, I could hold my head up as high as I could, thereby stretching the spaces between my vertebrae, which I figured is what was hurting because of all the bone spurs all around the discs, or whatever else is going on there. But when I would walk with those poles with my head up, I would reach out and put the pole down, and so I would reach out and could make these strides. And with the strides, I could do it. And so we went down there one day. I realized that all the snow that had fallen, our neighbor had plowed out the road to the moat, around the moat. So I wanted to go down there. But the one day I didn't feel I had too much back pain or whatever I was dealing with. Oh, I remember. I ate rice. I put rice in the soup for a few days. And rice gives me fibromyalgia pain. So I had forgotten that or ignored it or something. But anyway, as soon as the morphine was out of my system, then all the pain from the fibromyalgia flared. So I was in agony. And people were saying, well, you shouldn't be in so much pain now. It's been a while since your hip was done. That shouldn't hurt. Well, really, that wasn't what was hurting. I mean, it was sore enough that I couldn't lay on that side. It does have this huge 10-inch scar or cut or whatever. Anyway, so that next day, I did take some painkiller, and then I went out there. I really wanted to walk that because it was plowed and we could get lots of snow. I don't know how much he's going to charge us to plow that. It's quite a long way. But if he charges a lot, we can't do it much, right? Of course, once we stop doing it, we really can't do it the rest of the season. Anyway, whatever, right? So we walked it. That was so good. But then it turned really cold, really bad cold snap. So I was walking around on the balcony a few times a day if I could. And then I'm not sure what happened after that. Oh, I know. Our son came to visit and we had to drive him home, and I went with him. And being in the car for more than 20 minutes, it gives me lots of uncomfortableness. I'm not sure what hurts. Sometimes a bit of it's my hip, a lot of it's my back. And then I get this pain that's lower down in my leg and in my foot, down past my knee. Anyway, so, it's all those other pains that are slowing me down as well. And getting in and out of the car is also difficult, You have to, whenever you get in a car with your pain, you open the door, you sit on the seat with your legs facing out. You just sit there. And then you hold on to the thing, usually with this hand, and you swing yourself in. So your both legs are together and they just go in. You don't reach one in and pull the other. No, that'll hurt. So you hold on up above and you just rotate yourself. Your butt's down, so you just... And that's pretty good. But getting out and getting in, it all takes time. It takes energy and strength and stamina. And perhaps laying around a lot for a month has weakened me. I haven't gone up and down the stairs too many times. Just lately, like we went out that day to take Abe home, and that was a few hours. I was in terrible state when we got back. And sorry, just saw a flaw in my new room. My perfect new room. Anyway, so here we are on the 30th, and I really should be fine now. Maybe not. But we've got Christmas coming up. It's the 17th of December, and of course it's another 10 days away. No, 17th to 27th is 10 days. 8 days away, so I've got another week. And so if I do my exercises and try and walk around outside a bit, you know, you can't stay in the house because the house is pretty crowded for walking anywhere. Anyway, so that's the long and the short of it. So thank you for all your well wishes. I shouldn't moan and complain about stuff, but you know, I was also thinking that anybody that's gonna have this, if I could make a record every day of what I'm going through, then somebody else that's gonna have this operation can go and look at these and see how recovery time will be. It was really important not to get an infection. Really important, because if you get an infection in that open incision, it goes in and it attaches to the new piece of equipment that's in there. And they have to actually go in, remove that equipment, clean it all, put in something else in the meantime, and sew you back up. And then you have to get operated on again to put the permanent one in again, once it's all completely clean and everything. So you've got to go through surgery, hip surgery 3 times on the same hip. I did not want to have to do that at all. And see, because I don't have a lot of pain, just idle pain in my hip, I didn't want to do anything that would cause more. My biggest problems with my hips are that if I walked for a while, they would hurt so bad I couldn't go on. But if I was just doing regular stuff, my hips didn't really bother me. My back was the worst of everything. And I was on Enbrel, so it took away the inflammatory arthritis pain. So I was alright. If I tried to swim or something, I would get in agony. And I would go for days in agony with that hip. So although I didn't have pain all the time because I had learned what to do not to have pain, I went ahead and got this operation, and I'll get the other one done too. If they've got an opening for me and I don't have to wait a year or a long time for it, then I better take advantage of it, right? But when they called me to have the first look at my hip and talk about the surgery, I thought I was going there for my back. I was surprised they were checking my hips. Anyway, it wasn't the back surgeon or back anything, so I figured I'd go with them, because I haven't heard back from the back people even yet. There's long waiting lines in Canada because so many doctors go to the United States where they can just name their price. And so we have a brain drain. So our best physicians who are educated here at cut rates because we're trying to help them out because it's so expensive. And then they go down there and practice down there. So anyway, so we have long wait lines for that reason. Because there's a cap here on what OHIP will pay. Anyway, so that's my day 30th update. Talk to you later. Goodbye.